I had the skin that had acne all the time. And even at 48, I can have blemishes. And then my husband suffered from eczema. So he never had a zit in his life. Unfortunately, all three of my kids got my skin. I tell them that they won't have as many wrinkles as they would if they had a skin, but they do suffer from the acne. And, we're talking about not just acne, but we've got rosacea. We do have eczema, psoriasis. The skin is a window into the health. And you've come on before talking about the gut-brain axis, but now today we're talking about the gut-skin. So I'm super excited to talk about this. My least favorite question when parents come to me is, what product can you give my son who eats Doritos and pizza and beer every day for his acne, right? Because
Yeah.
it's not that simple. So let's get into it. Let's get into what does it mean where the skin is the window into what is going on inside the body?
Yeah, and so it's beyond a window. I would actually say the skin is both a window and a door, based on some new research, and I'll explain what that means. And when you say my kids got my skin, to be even more accurate, it's not that they got your skin; it's that they got your skin and your gut, right?
Right.
And so that combination of dysbiosis on the skin and dysbiosis in the gut is what drives a lot of the inflammatory outcomes on the skin, whether it is psoriasis or eczema or some form of dermatitis or even acne. Those are all inflammatory conditions of the skin that are driven largely by a combination of having dysfunction in the gut and dysfunction on the skin. Both things typically need to be present in order for those to manifest themselves, right? So, what do I mean when I say that the skin is not only the window but also the door? To put it, more finely, what that means really is that we used to think of the skin as a representation of how unhealthy or healthy our insides are, right? If your skin is aged, if your skin is inflamed, if you've got irritations, sensitivities, fine lines, wrinkles, dryness, all of those things may indicate that the inside is unhealthy and it's being reflected upon the skin. That's still true. However, there's nuance to that now, and there's a new dimension to that. Studies called there's a big study, and lots of studies have come out of it. Lots of papers have come out of it, called the Baltimore Longitudinal Study on Aging, that has shown that the skin is not only a reflection of the inside, but can be an independent risk factor of driving aging and age-related disorders internally.
Wow.
So, aged skin in this study, and I'll explain the study in a moment, was found to be an independent risk factor for creating age-related disorders like osteoporosis, cardiovascular disease, dementia, Alzheimer's, and so on. So imagine that skin dysfunction was a driver of these conditions that we normally don't relate to the skin itself. Now, what was the study, right? And how do they do it? So this is a very interesting study because it was one of the first longevity or aging studies that followed each individual throughout their aging process. So most aging related studies, what they'll do is they'll take a cohort of, let's say, people in their 80s right now, and then they'll compare a number of things to people in their 30s right now. The problem with that kind of approach is that people in the 80s went through very different things when they were 30 than current 30-year-olds, right? So it's not a apples to apples type comparison. What this study did instead, and this was nearly 50 years ago, is they got thousands of individuals and they said, let's follow each individual as their own control through their process of aging from their late 20s, early 30s, all the way up to their 80s plus. And let's mark and record and figure out all the choices that they make, the lifestyle, the diet, everything, and then and how that changes their outcomes when it comes to disease prevalence, disease risk, mortality, and so on. Right. So this was a really fascinating study. And then when they looked at predictive analytics, when they're trying to look at what within those individuals could predict their risk of chronic disease and even death, they found that aged skin was a significant predictor of chronic disease and death. And included in that is inflamed skin as well, right? So dysfunction on the skin was actually not only a predictor, but a driver. And they found that the skin usually starts to get dismantled almost a decade before those diseases become prevalent in that individual, right? So the skin is a driver. And so this is what we now refer to as leaky skin. So you have leaky gut, which is driven by dysbiosis in the gut. Leaky gut leads to all kinds of inflammation and nutrient disruptions, immune dysregulation, and so on. And we'll connect all those to the skin as we go along here. And then we have leaky skin, which is also driven by dysregulation of microbes on the skin, which drives inflammation, barrier dysfunction of the skin, so things actually leak through the skin when they're not supposed to, and then recruitment of unfavorable immune responses.